to A Dose of Melanzy.
Hey guys.
Season 2, episode 2.
Finally,
We are here once again. Thank you so much to our supporters and our viewers. And on episode 1, we forgot to mention, we just want our supporters to know from last year, we spoke a lot about depression and mental health and divorce. And for this season, what we want to do is we want to focus on interventions and things that we can do to help cope with these problems that we mentioned and that we went through last year, like depression and mental health,
ADHD,
co-parenting. Yeah, it was so much. So this year we're gonna bring in the experts. We brought in some experts already. On episode 1, we had my boss, Indira Santana. She came on here and she spoke about hormones, and everything starts with hormones, right? It's a big thing right now. So I'm sure you guys are going to watch that episode and you're going to love it. If you haven't, go to A Dose of Melanzy and watch it. And today our guest is so special. She does hypnosis therapy. Her name is Sol.
Hi,
welcome to our show.
Thank you.
So let's start with the basics.
Yes.
What is hypnotherapy? Hypnotherapy. Sorry. Yes.
So I practice age regression hypnotherapy. So as a licensed clinical social worker, I'm also a clinical hypnotherapist, but my specified in age regression with the hypnotherapy. Because when people think about hypnosis, they automatically think
just like
trance, you're not moving. No. So this is more of, so I'll separate the two. So hypnotherapy as itself works with two parts of the mind. So it works with the subconscious and our conscious. Our subconscious is the mind that is ingrained with how we may have been raised, how we've been conditioned, beliefs, that internal narrative, and controls our conscious mind, which is literally what we think about every day.
Right, those intrusive thoughts.
Yes, but we can't tap into the subconscious. So what makes it really special is, unlike talk therapy, which is something I know you're familiar with, talk therapy tends to take a lot longer because one, it can be manipulative, not manipulative, but manipulated by the client, where they may not be honest, they may not want to be transparent.
You only work with what they give you.
Only what you give you, versus within hypno, it's really hard to go there when you're connecting to that subconscious mind. So with the age regression piece that I specialize in, I like to look at it, it brings us to some of the earliest moments of when maybe that belief, that thought, that pattern may have took place. So like an example, I may have a client who every time she gets in a relationship, she's anxious attachment. Fixated on her partner. He didn't text me at the same time today. He
like
did that.
Just 10 seconds later, she's already getting anxiety.
That fear of abandonment, that fear of rejection. So then with the age regression, what we do is, okay, when is some of the earliest moments that you felt that? And it's very humbling because sometimes it's nothing what you think. And like, I felt this way because my mom or my dad or maybe another situation that happened. And we're able to really go to the root, ripping off that Band-Aid. So one session of hypno is equal or equivalent to at least up to 8 sessions of talk therapy. That's 2 months of sessions within that one moment, with that one experience.
You have to be very committed.
Yes, absolutely. So it's really great for mood disorders, PTSD, bipolar, anxiety, depression. I don't recommend for psychosis or schizophrenia. I do not. It's also great for addictive behaviors and phobias.
How would you say that would be triggering for schizophrenic?
Psychosis. Psychosis.
Yeah.
Oh boy.
No, ma'am. Yeah. So I wouldn't recommend.
So what's an example of like the behavior of psychosis that in that case will be endangering to himself and other people?
Well, I would say even the auditory, like if you're hearing voices, if you're hearing this, I would not want to put anything to induce that.
Yeah, that makes sense.
Possibly, and it's just not recommended medically or clinically. So research also shows it's probably not the best.
Yeah.
But it's great for mood disorders. It's great for, like I said, the phobias, the addictive, and even some. I always like to say, like, not your traditional therapist. I even ancestral healing, even healing generational trauma, even things that are just outside the DSM-5.
Right.
I'm very big on that. So outside of the hypno, I also do I do traditional talk therapy, like psychotherapy. But I'm also a Reiki master teacher in both Kundalini and Usui Reiki, which is like the chakras and energy. But I do spiritual work. I work with ancestors. I bring it in. I combine the mind, body, and spirit in my practice. So that's something that I believe in. I don't tend to look at the DSM-5 or mental health as disorders.
So those who don't, our viewers, the
Yes.
the DSM-5,
Yes.
what does that? I know that basically diagnoses
Yes.
patients
Yes.
with disorders and things like that.
So it's a diagnostic statistical manual, girl. Basically, it's a big old book. It's a big old book. It's
We'll
a Bible.
put it down in our
And it has every diagnosis known to man in there. And I think I say this with my heart because many of them come in feeling attached to this diagnosis. They're attached to the disorder, and I'm like, no, I don't.
I feel that.
Right? I'm like, no, I work with your symptoms. You're a person. Everyone on this planet has a diagnosis and a disorder, whether you're in denial or not. Sorry, but you do. And at the end of the day, I work with your symptoms. What is your body telling you that you need?
So you said one session is equal to eight regular cycles.
That's deep. That's deep.
So how many sessions do you recommend?
It all depends. Everyone's different. It all depends on the needs. But usually, as a general base, 4 to 6 is nice.
Okay.
4 to 6 is nice. But again, it depends on the needs of the person. Yes, like some person will do great after 3. Like when we talk more, how when someone else has it, they also sometimes as maintenance or as part of. So I have some that see me for talk, but also do hypno as well. So we'll do talk, and they're like, this month I'm feeling I'm on edge a little bit. My body is like, I'm like, okay, let's put in a hypnotherapy session. So I do very based on the client's needs and where they're at and their symptoms.
Okay.
I love that we're talking, but let's backtrack a little bit. For him, what was your journey becoming this? And it's not everybody just decides, I'm going to be a hypnotherapist. You know what I mean? So I know that for you, it was probably an amazing journey. Like, what got you? And like, what is the process to become a hypnotherapist? You know what I mean? What is the journey to that? What led you to that? And then when you get to that decision, like the certifications and licenses that you need to get?
Yes. So what got me to do hypno, it was everything that I practice is personal for me. So whether it was therapy, I've done that. The same thing with Reiki and energy, it was for me. I would say a traumatic experience, maybe trauma. I don't want to call everything trauma because life has its own experiences. I think for me, I have PTSD. So for me, and I've done energy work. I'm very what's the word I want to use? Like I'm very diligent in the work that I do for myself, whether it's maintenance, however you want to call it. So I looked into receiving that myself, which I worked with a provider. She's in Chicago, which was virtual. And then I looked into the schooling and the credentialing that she had. So she brought me and she was like, you would be great. This would be great. You're passionate about it. I'm like, okay. So I did this extensive wellness institute. I want to say it's over 600 hours that we had to do. We had to work with other providers, other clinicians from all over the world. And we had to do the clinical work. And I think, I don't know if I was saying this to you guys when we talked in before. No one cared about credentials. We had PhDs, LCSWs, you name it, and they're like on the other side of the world.
They don't care.
They don't care who you are, what medical experience background you have.
Like, make me feel better.
All of
They were more intrigued by my Reiki master certification. I went, I'm a Reiki master. They're like, oh, you do Reiki? Oh, you do? I went, yeah. And there were more.
What is Reiki? I'm sorry.
So Reiki, two kinds. So I would say the Usui is the one that's known here. It's a Japanese healing modality that is used in hospitals for pain management, cancer patients.
Wow.
So you can volunteer in the hospitals and provide that. Hospice. So that deals with your chakras, which we all have. It also aligns with your body, your emotional feelings, mind, body, and spirit. Again, it's Chinese medicine. And it connects with the universal, I would say your universal life force, whoever you connect with. It's not your energy per se, but it's the energy of universe that's connected with keeping you balanced and aligned, all of that good stuff. Usually it's also connected to somatic symptoms of your body. So if you get the neck pain, the shoulders, a lot of times there's an emotion connect to that people don't realize. And somatic symptoms are real in the medical field.
Absolutely.
When I'm having a very anxious week, I'm like this. I gotta remind myself to.
You got the cortisone shot?
Yes. So it's more. So I look at that as also another way of healing, another way of keeping yourself in line. I think this side of the world that we practice medicine, unfortunately, I feel like it's a lot about medication, a revolving door, put a Band-Aid, and that's it.
That was me, in the last episode about a lot of, that's what they teach us.
Correct.
And I do want to, I'm glad you brought that up. And I want to talk about that because I feel like this is what they train us to do. It's nobody's fault with this thing about not knowing hormones. We probably have like a page and a half about hormones and menopause and all these things. And we are trained to diagnose and treat patients. That's all. We're not here for preventive reason or anything like that. So that's deep.
And that's how it is for mental health. So I could be a psychiatrist and prescribe all day. I choose not to. That's my choice. I know I'm knocking it. I absolutely understand medication may be needed. But I always say, sometimes, unfortunately, are you going to the root?
Are you
the problem?
And that's also about a part of addiction, addictive behaviors. Where in this society, we're taught to numb our feelings and not to feel. Therapy is about, or life is about being able to handle your feelings and feel. You cannot heal if you don't feel.
We have to unlock that child.
Absolutely. It's a domino effect with everything. And it's like what you said, going back to the root, it's really sad. But when you, first of all, it's a whole chain. Once you misdiagnose the patient, they're misdiagnosed now. They don't know what they have, going on. And now they're not really getting to the root cause issue that they're supposed to be dealing with, like you said. A lot of things are maybe the mind, or maybe you just need, like you said, a little hypno to fix. But no, we just put a bandage on it. We just go ahead and give the medications and call it a day.
And I can't blame them because they feel better in the moment.
That's what I was gonna say. That's what I was gonna say in the moment.
Then after I don't feel good. I don't need to up it.
Medication.
They up the medication. It goes higher. It goes, and I'm like, without doing the work. And I get it. Not many, and culture plays a huge role. I'm gonna call it what it is. I come from a Latino culture. What? You don't talk about feelings. No, I'm sorry. And if you do, like you cry, I'm gonna give you a reason to cry. So
you don't got no problems. No. Nobody. Your problems are very minor.
Yes. Like, what do you mean? Please, like. So that comes from me even being in this work, social work. I've been in the social work field for over 20 years. Prior to being in private practice, I've done child protection services. I was an investigator. I was a treatment worker. I worked in the schools, trenches, you name it.
So this is not only like, okay, I'm just gonna do. You have an extensive. This is amazing because you actually went to school. For Chinese medicine and all these. It wasn't like, I'm just gonna wake up and do a 2-hour certificate program like a lot of people. Nowadays, you have to put in the work. You have to put for whatever specialty or calling, because that's another thing. Not everybody's called to do certain, and that's another thing I think, and this is why when we saw your page and everything, brought so much good, positive vibes and attention because it's not everybody that's called for things like that. And it looked like you were one of those.
You have a great energy to you. And speaking of energies, tell us about your mindset before session with these clients that you may have never even met before.
I pray. I say a prayer. I just pray on it. I just pray that, dear God, allow me to help the person that I'm meant to help. And I try to keep myself as open, as calm. I'm often told that I'm light. That's where the name holds, the Sol Estrella, the whole practice name came from. It's a long story from that. But light, I would say, I just try to be that. I don't want them to feel judged. I want them to feel safe. I have a very seasoned life. So I would say that, I can relate to a lot of things.
I'm happy that you brought up, you pray, right?
Yes.
You pray to God. Some people would say, how can you pray to God yet you're practicing Chinese medicine?
What's the I don't know, what's the disconnect from that? What is practicing medicine or Chinese medicine has to do with having faith?
Yeah, I agree.
Right?
I agree.
And it's interesting you say, because I have clients that will come in and go, what do you believe in?
What does that have to do with what you're
doing? And I'm like, if I let's just say if I didn't, right? I would say, hey, I believe in something good, the greater good. I work with light. How about that? But yes, I don't think that way. I'm not put in a box. I'm very open. Like if I connect with Buddhism, I'm gonna connect with Buddhism. If I connect with Ifa, I'm gonna connect with the religion of Ifa. Santeria, whatever. I was raised Catholic, and I also had that Santeria background too.
Okay.
They both was
bumping heads.
Oh, absolutely.
So the worst of the both.
Yeah, I grew up in that too.
Yes.
We grew up in the Dominican Republic, all of that, the voodoo, the Santeria, that's what you grew up in.
Yes.
My family is Catholic Christian,
Yes.
like I've said before on this part. And it's just...
It's amazing.
What does that have to do with it?
No.
It's what you practice. Doesn't mean I practice it, but other people might. But what your belief is your belief. The light, the God, or whatever. It doesn't
And
make
it's
a
good
difference.
in every practice. Voodoo, hoodoo, it's good in all of them. And that was on my journey doing Reiki. I worked with other practitioners and healers from voodoo, hoodoo, Santeria, Ifa, and that opened my eyes because there was that Catholic part of me where, hey, my mom's like, oh, don't you dare.
No, but I think what I've learned is how they use it. It's not the person, because it's not the actual practice. It's how they use it. If they use it in an evil way, that's what's going to be. And that's with anything. That could be with any religion, with any practice, with any. So when people say, oh, voodoo's bad, no, if you know the actual history of a lot of these things, yep. Absolutely.
It's all about the intentions you put into it.
Absolutely. And then and a story with that was I had a voodoo priestess working. I was talking with her, and she said to me, she was like, oh, well, you were raised Catholic. And I said, yes. And she goes, let me tell, I said, they made us think like the voodoo dolls. She was like, no, that's energy. That was sent to the slaves to help them get out of their situation. We were sending them energy, prayers. She goes, you were raised in Catholic. I said, yes. She was like, what's up with the priests that use them churches to molest all them kids? I went,
so then,
yes, you're right. She was like, there's good and bad
in everything. It's about the human and what they do with it.
Yes.
It's about the human, because if they become evil and they use that to be evil, it's gonna be evil. It's not the actual practice.
Absolutely.
It's crazy.
And I think that opened me to go deeper as a human, as a person, as a spirit, to where I feel like maybe that's why my practice shows what it shows. I'm not the traditional therapist. I don't look at you as diagnosis. I don't look at you as a disorder. I look at you as a spirit, a beautiful spirit that may have some symptoms. How can I help you? That's all. How can I help?
Yeah. So what's the outcome? As a client going in, what should I expect from a session with you?
Oh, it depends. I always say varies. I think how open you are, how open, how ready.
Yeah.
If you're coming with an open mind, if you're coming in being positive. If you're coming with resistance, you're gonna get it like anything else. It's like going to the gym, right? You can't go to the gym one time and expect to be in shape. I'm sorry.
It takes a lot of work.
It takes a lot of work. Commitment.
I'm still trying to go to the gym.
It's like take accountability. I think be open. But again, it all depends on the individual. The more open you are, I think the more better experience that you'll have as overall.
Okay, so can you tell us about the actual session, the actual hypno session? What does it look like? From step one to all the way till they leave?
Do you want me to bring when we kind of chime in with us? Is that okay? Okay. So kind of like what you experienced when you kind of came in.
So I did a session, guys, last week.
So she came in last week. I was so honored. So behind the scenes, I feel one of the things I don't advertise is my intuitiveness. So I do receive messages and downloads, hence why I do some spiritual work on the side. Okay, so I felt that from you. I was getting it. I hit you up on the side, and I'm like,
So we had a meeting with us three, and the energy that her and I had in that call, I was like, I need to book a session
ASAP.
Immediately. And
it was like in the next 2 weeks.
Yeah,
the next 2 weeks.
We were talking, and I got so emotional. The hair on my arms just.
You felt it.
I felt it.
You felt that.
Like I was telling her. Sorry to cut you off.
No, that's okay.
I was at a point where I just felt like I need something else to get to the next. I didn't know what it was, but I was just like, I need something. And then we had the call with you, and it was just like,
But I mean, a lot of our viewers know, like, what brought you to make that decision to book a session with Sol?
Man, so our audience, some of our audience know that I live with bipolar. As a single mom, a lot of things that have happened to me after giving birth exacerbated my symptoms. Then it was like a 2-year journey of just being in a state of confusion and all these things. And then now, fast forward to now, I'm in treatment, consistent therapy, which is now I feel like I'm stabilized. And then all of a sudden, just
a dip.
Just a dip. And then, you know, I know there's a lot of things that I was holding on to and still am, but it's, you know, it's a process.
Right. Absolutely.
So there was just I feel like there was like a wall, there was a block, there was something there that I just couldn't push through. And then when she explained what it was, I said, that's it, I gotta come.
So we're working with Z with her hormones, and we're gonna work
girl,
with her
I'll be a whole different
and now we're
person.
doing hypnosis
After
therapy.
season 2,
You're
I'm
gonna
be
be good.
That's awesome.
She's a whole new person.
person.
So after all that, you decided, you know what, I need something else.
I need to go see Soul.
And then you booked Soul, and
Yes.
how was that experience? Like from the beginning, I want to even hear when you was driving over there.
First of all, I was anxious as hell because I thought I was gonna be late.
Yeah.
So I already got there.
She
and
was
I
on
just like,
time.
my whole body was just, I was on time. My whole body was just so tense. But then I get in there, before the actual session, we sat down, she asked me some questions. The first question, I was bawling. I didn't even get to the actual session.
Wow.
She's like, so how you doing?
Yeah.
She asked me, how you doing?
The waterworks.
You know,
oh my God.
So you said age regression. So before the actual session, you had me, okay, so when was the first time you felt, you know, we were going back, she was writing notes.
Oh, wow.
Because there was a lot. There was like, when you came in, you were really charged.
Yeah.
So I was like, okay.
You
and
need to unpack all that.
So I was like, I usually do like a check-in, kind of see where they're at, gauging her. I already felt you were comfortable.
Yeah.
With my energy. So I was like, okay, this is nice. You were open. You were like, so I was like, okay. So the office was already set up for her. I have a lot of plants. I use a lot of plant medicine around with this kind of work and groundwork. It was this nice mat for her to lay. So she was talking to me, sitting with me. We were checking in, and there was a lot of points that were coming up. And I wanted to get the emotions, because a lot of the times we go into a somatic shock when we talk about our traumatic or an experience that's very stressful, but we could use a lot of words.
Yeah.
We can intellectualize it, especially you being a licensed social worker. I know that you know how to. I don't want that. I want the feeling.
Right.
I want the heart. I don't want the brain.
Big words and all of this and all of that.
So I wanted the heart space to open up. So we got her.
Is everybody have the same setup, or everybody is in a different place, different setup? You can do this anywhere.
I mean, this could be done virtually and in person. I think how I set it up is what I take in the properties that mean something to me.
Okay.
That's interesting with the virtual. How would you even do that?
So they will be laid. Yep, they'll be in bed. They could be laid on a couch or something. Long as they're relaxed and they're not disrupted,
they hear you.
They can hear me.
Yeah,
because I've done virtual sessions.
Mm.
And as long again they're able to be in a relaxing state, no disruptions.
Right.
The audio, everything is nice. And we're able to really go there. I've had mine virtual because of my personal is in Chicago.
Yeah.
And it was very powerful.
But in person is just a
Yes,
whole
of
nother
course.
experience.
There's a whole
so
nother
therapeutic. Your space.
So it was very much set up for her to feel safe and comfortable. And one of the things you did say when you lay down, you're like, I do feel safe. And I was like, oh, and your little kid started to come out.
Yeah.
So I naturally would start guiding you into a hypnotic state. So that's what we did. We kind of had some eye fixation. Yeah. She responded very well. She went into a hypnosis.
It took me a minute because the outside was very noisy.
Yes.
So it was very helpful that you had me fixate on something
spot
on the ceiling.
Yes.
Wow, that's how good you are. Even with the background.
She guided me perfectly.
That's deep.
Yeah.
And you went right into it though.
Right in.
Oh wow.
Now
I need a session. Where's my session at?
I
need a
the minute I
session.
booked, okay? I was ready for a whole month.
Yes, so we were able. So once we went there into that space, then we guided into a safe place. Called in if you had a spiritual connection, anything. Because I honor people's faith and spiritual connection.
Yeah.
Whatever. I don't care if you believe in a tree or you believe in Jesus. I don't care. We're gonna bring it in.
Yeah.
So we create that safe space, and then we entered the adult self, which really helps us deal with moments in the session that you may feel a lot. And I like to bring that adult self in sometimes to remind you, no, you got this. Your adult self got you here. That's probably why you showed up today.
Right,
don't forget you don't have that strength. And then we dived into that emotion that we wanted to work on. And then we went into the age regression. And she went, went.
There were things that
when you say age regression, what is like back to your kid self, being a baby?
It could go as early into a past life.
So she was like,
everyone's different.
Tell me a time, tell me a situation when the first time you felt betrayed. And a situation that I haven't thought about in over 15, maybe 20 years came up.
Oh,
it was immediately went to the incident.
That's deep.
And at the time I was 15 when it happened. I totally forgot that even happened.
Yep. It's so humbling. Because mine was like a 7-year-old. When I did mine, I was like, I don't remember that. I was 7. I thought I worked that out.
Right.
Because that's deep in your conscious. That's deep.
Yes, it's right into our subconscious mind that she don't tap in.
Right.
But that piece, that narrative that was connected to her 15-year-old self, controlled herself today, her conscious today.
And everything, it was like puzzle pieces that came together. One. I'm 15, I'm 8, I'm 6.
Why were you like reacting this way to certain situations, or like your whole life?
Correct.
Or like
that
you're
narrative.
right, current my adulthood, and then after leaving, you're like,
it's mind blowing.
wow,
it makes sense.
It
makes like ding 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 ding.
Light bulb just
like
went
it
off.
makes sense.
Yeah.
This is why, and everything is when you read every book in psychology or in anything or in any type of that. It goes back to, what is it, the oral stage?
Oh my God,
Erickson via this and that, and
Sigmund
Sigmund Freud and all oral sexual crap, but it makes sense now. And it's funny how life is.
Right.
Because that means that we go back to being, it's like, we go through our transitions, then we go back to being babies, like my patients in the nursing home.
A lot of people don't take in consideration, what did you go through in your mom's womb? Bro, there's trauma there.
That's real.
Let's just.
I never thought of that.
Mothers go through,
and from your
They
grandmother,
feel it.
the
They say they feel
DNA
it.
is carried. Our grandmother's DNA. All this is connected. Like there's so much into generational trauma, and I don't want to throw the word trauma so loosely, but trauma. We're talking about it. Yes, it's so connected to what they don't teach us, like you said.
Right, and I am determined that my daughter will not experience certain things. It's inevitable. She's going to experience just,
you cannot kill off 20,000 generations on one.
With me, but I do know this is that I'm going to do the best that I can to show up for
Absolutely.
her.
Broke the cycle.
And that
start.
was my motivation to see Soul. Said I'm gonna do this for myself and for my child.
Amen.
You know, and
I felt that.
Speaking of child, she told me to bring a pillow and like a soft whatever teddy bear. I actually brought with me one of Ava's Squishmallow teddy bears. So in moments of like, I guess.
So that's the inner child. So I always close with the inner child so that we can take the negative to the positive. And then that's where that positive suggestion comes in and how I gave you the index card. I put it all, whether it was your safe place, your adult self, the age, the color that may come in to make that experience stronger. And then giving the inner child what you need, what she didn't get because of whatever she went through, so that when you come out of hypnosis, out of that deep, deep relaxation, your brain in some way can be rewired from the negative to the positive. And that's why I said, say this the next 21 days, because like anything else, you do something for 21 days, it usually becomes a healthy habit.
Yes, I was holding onto the pillow and to the teddy bear, like in those moments.
She was so cute. Do you remember the name?
I actually don't.
That's deep.
I remember the name. I remember the name.
Okay, we'll keep it in secrecy.
Tell me later.
What if for people that don't have kids? What else can they bring? Something just from their childhood?
Something that makes you comfy, that makes you feel safe.
Okay.
Yeah, that was my decision. I just wanted to bring something of Ava's.
No, that was perfect. And that's what makes you feel safe.
Right.
You know what I mean?
Right.
And as the session was going on, you were writing some things that were positive affirmations
to change that
connected,
negative.
right. And then she gave me that index card to leave with, and whatever was on the card, like she was saying, you say for 21 days. I have it in my car.
Yay.
I say it every morning.
Yes.
So
I checked in with her the next day after, want to see how she was feeling, and some of the things, feelings are not facts. remember that they're not always true. So just kind of checking in with her, and I was so happy that then when I saw her today, I was like a little kid.
I'm like,
week. How are you feeling?
I had a really good week. I just woke. So that was Saturday.
I'm
so proud of myself. So that was Saturday, and then Monday I was back at work, and I felt so rejuvenated. I was empowered, and whatever was happening in the moment for me, it was kind of just like
just slip it off.
Yes,
it's not
that's
important.
It. Yeah. That's just
and that's
what
the thing
it
with
is.
Z. She gets in her mind, and once or if
bad.
something just starts off like her day in the wrong, that's it.
That's it.
No.
Days
that's
up.
it.
Right.
Yeah.
Right.
So I know that even me sometimes, and I think we have to learn how to, like I even gave you the advice, like we have to just try to not stay in that fog for so long. And I guess that's where you come in and give some tips that helped you, and that's amazing.
Yeah.
I want those tips, man.
So where are you located?
So
where can we find you?
Yeah, so you can find me. So I'm on Psychology Today.
Okay.
So Sol Estrella LLC, and then I'm also on Instagram at Sol Estrella LLC. I have a private practice in Newington, Connecticut, off the Berlin Turnpike. So it's a straight shot, right, from New York. Is it Route 5? I don't know. Horrible the routes, but whatever. I have a lot, right? I have plenty of New Yorkers that do come see me. That do see me from Queens. They drive down to Queens to come see me. And I also have people from out of state as well that I usually keep the weekends open.
Okay.
That's why I really try to do some of that hypno and the energy work. But again, it's also virtual as well. So I have clients that are obviously outside of the country and in other states.
Nice.
So
outside of the country.
yes, I know. My friend from Saudi Arabia, she actually wanted to watch this. She was like, "Do you have it?" And I said, "I will let you know." Her time zone is so different, but she texted me at 5:00 this morning. She's like, "Is it today?" I'm like, "It's today." So I'll let her know. And I'm also licensed. So I'm a licensed clinical social worker in Connecticut, but I'm also, I just found out I'm also in Florida as well.
Florida, yeah.
See what comes out. Thank you. So it'll be fun. So new steps, baby steps.
Do you have any other questions?
What advice in closing? Like, what advice will you give people that are seeing this today, our viewers, and they've gone through trauma and they're going through a mental health issue? What will give that one advice that you will give in reference to what you do and people?
I would say you're not your diagnosis. You are not your trauma. You are not your disorder. You just went through life. And anything is possible towards healing, towards feeling. Do not be scared. Do not have this judgment. Do not have the stigmas taint your experience of getting maybe some of the support or help you need. And I would be honored to be a part of that journey if you trust me and allow me to. So
Sol Estrella, everybody. Yes,
I love it. I cannot wait for our next session.
Yes,
Thank you so
Thank
much.
you so much.
Definitely book
A guest on here.
Thank you for coming. Thank you for taking out the time. You guys, thank you for watching here at A Dose of Mel and Z.